I've had a lot of requests to do a short version of radial nerve mobilization, radial nerve flossing, radial nerve tensioning, neurodynamics. So we're going to show you exactly the setup, how to get through this thing really nice and quickly and to make it effective at the same time. First of all, in radial nerve problems, you've got to make sure that their shoulder is off the table because you've got to stabilize the shoulder with your thigh. Make sure you're over here with your thigh. So I'm stabilizing the shoulder because otherwise the technique is not going to work. I see a lot of people in workshops coming off this here, doesn't work. Okay, so stabilize that shoulder. Now I'm going to teach my patient what I want them to do. Left side bend your ear to shoulder as far over as you can. And what is that doing? That's pulling the spinal cord her direction toward the head. It's also pulling the nerve roots. It's also pulling the radial nerve, which comes down through these fingers, as we know. So we're pulling this thing her way. And then I'm going to set up my end so that I can pull the nerve root the opposite way so that we can nerve floss it back and forth. So with shoulder nice and pinned there, I'm going to make sure that she's got this tucked in there. The thumb needs to be tucked in like that. And this is really key. It's simple, but it's really key. She's tucked in like that. She's got to ulnarly deviate. In other words, she comes over toward her ulnar bone, right? So she's got that motion, and then she's got flexion. That's because now we're putting that radial nerve really on a stretch right now. Can you see how that is really on a stretch now? But I don't extend the elbow because I don't want to pull the whole thing my way yet, right? All right, so here's what it's going to look like. I'm just going to ask her to, I'm going to actually guide her through this in the beginning. If the person has not done this before in your practice, you want to guide them through it. So you're just going to do this one-handed. It won't be as effective as when you do it with both hands, but this is how I do it in practice. Okay, so let's go to your left. She's pulling it her way. And then when she comes out, I'm going to extend the elbow, ulnarly deviate, and this would be nerve flossing. Can you picture that? How it's pulling the spinal cord that direction, and then the nerve out here. Okay, but the key thing is you really need to have both hands on this thing. So you come in like this, and you put it into internal rotation. Trying to get as much stretch as possible in there. Just picture that stretch. So this thing is all, see that position? That's really cranking on that radial nerve. But I'm not extending the elbow. So as long as this elbow's bent, we're cool. All right, so left side bend your head, please. Perfect. She pulls it her way. Come on back out. And I'm coming this way. Making sure it's not painful. Keep asking them, is that okay? Are you having symptoms yet? If they're having any kind of symptoms, you back off to the inner barrier zone a little bit. You don't go all the way. You just work at their tolerance level. If you start causing a stretch, an undue stretch, and it starts to cause pain, then you're just going to have protective muscle guarding and you're ruining the whole deal. Notice how the shoulder is still braced. Come on back. Nerve flossing, slowly, rhythmically nerve flossing. After a series of sessions, they start to get better, but they're still having a little bit of symptoms. You want to try to beef that nerve up a little bit. Nerves like to be stretched. They do stretch. A lot of people think nerves don't stretch. They stretch. So you stretch the nerve from both ends. And what that does is when you let go, it starts to suck in all the interstitial fluids, metabolic substrates, synovial fluid, hyaluronic acid, all that stuff. Makes the nerve healthy. So that's what we're going to do now, and that's called a nerve tensioner. So how do we do that? She side bends left, and at the same time, I'm going to come out. See? Now we're really putting a stretch on this thing. So this is when you really have to be careful because you're moving from flossing in a session to tensioning, and you want to make sure that they're ready to have it tensioned. So, okay, so here we go. Go ahead. Simple, easy breezy. Nerve flossing and nerve tensioning. Powerful, powerful, powerful technique.